What I'm going to do for about 30 minutes is talk about our work, particularly around using mindfulness and self-care within mental health work. And I'll give you a little bit of context and share a few slides along the way and a few visual aids as we kind of go along, if that's okay. So I want to talk a little bit about some of the projects that we've worked on, particularly how we approach self-care and mindfulness, and then some of the things that we've learned along the way. And I think probably before I go into anything else, I do want to say that this is offered as humbly as I can. I think we're very conscious there are different ways of doing self-care and mindfulness, of providing that and resources and support and techniques to other people. This is our kind of take on it, but also it's done probably with that sense of sort of social enterprise. We're a community interest company where we've discovered some things along the way. And so some of the things that I'm going to share today, I don't think I anticipated would have been part of our work or would have been part of the effectiveness of our work. Space to Breathe is a community interest company. We're based in Sheffield. This is our website if you want to have a look at that anytime. And well-being made simple is that kind of the basic approach that we try and take to things. How can we demystify some of the ways that we support our well-being and others' well-being? And how can we live healthier and fuller lives? I'm going to talk a little bit at the end about flourishing, but that extent to which we can grow and be healthy and be ourselves mentally and physically is kind of our part of what we bring. We're a small organization, and we started off really thinking that this service might well be towards community groups, people working in caring kind of industries, or to members of the public, or maybe even to corporate kind of settings. So it was quite a discovery to begin to work in NHS settings and with people who had diagnosed mental health conditions and how we might support them. And I guess the mental health continuum, which you might well be aware of, was part of that kind of journey for us. I don't know if you have seen this or you're aware of it, but we find that this is a really helpful little way of describing what it is that we do. Just bring it up on the screen for you. That if you have a horizontal axis of minimum and maximum mental illness, it's still within that. It's possible for you to be top left, as it were, to have good well-being, even if you have a diagnosed mental health condition. You manage that condition well. You look after yourself well. You provide elements of self-care. But similarly, it's also very possible that you might not have a diagnosed mental illness, but you might have poor well-being. You might not look after yourself so well. So we try and work on this upward axis. And I think that was our kind of journey of discovery initially, is how would this work alongside existing mental health services? I'm mental health first aid trained and CBT trained, so I'm not a counselor or a psychologist. I've not been through medical school. So how would this exactly work? And we found that the things that we do sit well alongside other care. So mindfulness and self-care being something that can sit alongside other support that people are receiving. And our learning's been done in 3 projects, which I just want to quickly tell you about, and then go into some of the things that we've learned. Just before the pandemic, we were asked to take part in a project around tackling inequalities in mental health, working with Sheffield Health and Social Care, particularly their forensic support unit, and then with a number of local charities. Sheffield Flourish and Faith Star and Sadaka. And the idea was to try and work through why 46% of those in residential mental health care, particularly in the forensic system, were from an ethnic minority, and yet only 19% of Sheffield's population were from ethnic minorities, from Black, Asian and ethnic minorities. And we found the tools around mindfulness and self-care were really good at contextualizing support, that we could use cultural stories and images and ideas. We could adapt practices like mindfulness in ways that made more sense to people. Began to learn about learning styles as well. One of the things we did find is this worked very well in transitions, when somebody maybe was transitioning from a medium secure setting to a low secure setting, that these kind of skills of learning to look after yourself, learning to manage anxiety, how to become present and self-aware really helped. The second piece of learning that we've been doing is a project which is still going, is around waiting list support for single point of access for Sheffield Health and Social Care, but partnering with 11 other voluntary sector organisations in Sheffield. And with this project, we're working predominantly on giving emotional regulation support. So people who need to learn how to recognize and to manage and regulate their emotions, things around stress and anxiety and how we manage that. Learning to become more aware of the things that we feel and to manage our emotions. The well-being zones tool that we use, it's just a 6-week program going through things like mindfulness skills, was what the mental health sustainability program helped us develop and has been used in this setting. And then the third one is maybe a little bit more left field, but last summer we worked with Edinburgh Fringe Festival to provide mental health first aid support and sessions for artists and directors and staff at the Fringe Festival. Really intense atmosphere, lots of long hours, lots of people bringing life challenges into that intense environment, and how to help with people to be safe, how to deal with things like stage fright, self-medicating sort of stress and anxiety, how do they balance work and life. And again, we found in these times that those principles of mental health first aid, of making someone safe, work really, really well. So it's with this kind of learning that we've tried to walk into this world of how you build resilience. And we've used this definition from the NHS website, which I find is really helpful. That resilience is an endpoint of self-care, if you like, or something that comes out of self-care, a product of self-care, is a key factor in protecting and promoting good mental health, and is defined as an individual's ability to successfully adapt to life tasks in the face of social disadvantage or highly adverse conditions. I try and think of resilience now in terms, and that definition in terms of sports clothing, where it moves with your body as you're playing a sport. So it's not the sense that those things coming at you shouldn't come at you, recognizing that anxiety is a part of life, that we do experience stress, but how we move with those times. And again, we found these tools of self-care and mindfulness and some of the principles around mental health first aid fit really nicely there, enabling somebody to be safe, to be grounded. This little tool to make your own snow globe has been something very helpful, that life shakes you up. And these tools of self-care and mindfulness allow things to settle. So resilience coming from a place of being able to have some firm ground, to be grounded as a kind of starting point of resilience, but also then adapting. So recognizing that life has its ups and downs, and how we manage those times, and how we flourish, we become fully ourselves. We have good well-being within those times, recognizing that there'll be ups and downs are important. So I want to talk a little bit about how we see and how we try and share the ideas of self-care and mindfulness, and then bring some learning on from that. But it comes from this definition of resilience is kind of where we kind of start off. And I want to look at just what these things are. And again, you may have different definitions or approaches to self-care. But for us, self-care is about those resources for self-support. So it's maintaining balance in life. It's maybe sometimes preventative. There are reflective skills so that you're understanding your strengths and weaknesses. Maybe like lifting up the bonnet of your life and looking inside at the engine, you begin to see what's working well and what isn't, where you gain strength, what things drain you, how you mitigate those times where you're drained. And the outcome might well be a toolbox of ideas to use, and you bring those tools out when you need them. So the goal is to be more resilient, but actually the process might be quite adaptable. You're learning to pick up different tools that help you. One of those tools that we use is a stress ball, and you may have come across this hundreds of times. But we find this can be really helpful alongside other care. Maybe sometimes when you're sitting with your psychologist and having given an individual a stress ball and taught them how to use it a little bit, it can be something that they can squeeze as they're sharing different things. Or maybe if getting outside is hard, that this is something that's a useful transitional tool to help you when you're on the bus going somewhere, or when you're going to the pharmacist to pick up your prescription. Little simple steps, things that can enable people to find safety when life is threatening. it can be some tools and techniques that can be quite helpful with self-care as well. And I just want to share a couple that we use. Firstly, self-awareness is really important. I love this quote from Carl Rogers, that curious paradox is that when I accept myself as I am, then I can change. So we've developed a simple tool called Notice, Name, and Accept, where self-awareness becomes something where I might isolate one anxiety or concern, notice it, see it for what it is, accept where it is, even if that's at quite a low place, to name it. And some people want to give it a silly name. Actually name it like a person, but also it might be naming it in terms of a condition or some diagnosis that somebody's had. And then to accept, to say, okay, well, I am there right now. So for example, I worked with somebody who was really struggling with travel anxiety, and that was really restricting their life and causing problems. So we went through this process of noticing each anxiety, giving it a name. And for her, it was the different bits of transport that she went on. So train was one. And then to accept, well, what is it that happens there? And then to begin to think of ways, tools and ideas that might help manage that anxiety. It doesn't remove the problem, but again, it provides a way of grounding through self-acceptance to say, well, this is where I am. Another one that we've used, again, this is from the NHS website, is Catch It, Check It, Change It, a way to reframe anxious thoughts. I'll often talk about self-care and mindfulness as like a piece of vinyl, and you imagine the grooves on a record. You get stuck in a train of thought. One way is to lift the needle. Things like a breathing technique can work quite well for that. Things that just provide a stop. But sometimes there's a need to turn the record over, and reframing those thoughts is one of the ways that we can do that. So to isolate an anxiety, to catch it, to check what it is. Why am I worrying about that? And then to change it. How can I think more positively? Now, those self-care tools are quite simple. They're quite mainstream. They're quite easy to kind of connect with and work with. But we found that they begin to give you that element of stability from which to work with. How can I confront things? And if you can imagine a self-care process where you begin to be grounded, you let the litter settle so you see things clearly. And then a technique enables you to isolate different things and to say, well, how might I look at that? How might I look at that? Now, obviously, that needs to be quite contextual to a person's culture and language, but also to their individual lives, to the way they think. For us as a smaller organization, we can work that way. We can be quite adaptive, but I guess that's one of the things we've learned, and we'll summarize at the end, is that working contextually seems to help. Everybody's life is different. Everybody manages their own self-care and their own mental health and well-being in different ways. But self-care being those resources for self-support, where we begin to build up a toolbox of things that work for us. Those are two ideas, many, many more that we share. Little simple stops or ways to reframe, to change the record about the way we think. Now let me come on to mindfulness, which is obviously one of the tools that we can share and teach. And we spend a lot of time working with people teaching principles of mindfulness. Predominantly, we're working in two kind of types of mindfulness, if you like. One would be mindful stress reduction, that way that we remove or release or reduce stress, finding a sense of calm. If you are familiar with the stress container, mindfulness being a way that you release the tap so some of the pressure goes. So things around breathing, ways to calm yourself, to find a sense of peace, maybe focusing on an object like a candle or something like that. But we also work with mindfulness-based cognitive therapy, where you think more about those trains and patterns of thoughts and ways that those can be reframed. But with both, we're quite inspired by some of the ideas that kind of developed in kind of early Western mindfulness about taking a thread of meditative awareness into our everyday lives. or the former Archbishop of Canterbury, Rowan Williams, put it like this. He talked about meditation and mindfulness as the capability of seeing. So not so much an emptying of your mind or a removing of things, but more a focus. How can I focus on one thing? Being present being one of the most obvious ways. Or maybe to focus on an object, or maybe to take notice, remembering the 5 ways to well-being, take notice being one of them. Can I really take notice of something? I was really influenced by 2 researchers, David Hay and Kate Hunt, who actually did some work for the Church of Scotland about meditation and spirituality, and use these 2 phrases, what I think apply really well to the work that I'm doing here. And one is about making sense, and one is about meaning making. That we can be mindful of an object, or mindful of a time, or mindful of being present, and that in and itself is of value. But also we can begin to draw meaning about our lives from those things. I went for a forest bathing work with somebody I worked with just 2 days ago. And he observed the way the river that we were walking past kept going. And he began to think about perseverance and resilience through that. He took meaning from what he saw. And it's worth saying as well that mindfulness is beginning to now have some of that recognition within different health services. And we talk about mindfulness and self-care within mental health work. There's a lot of recognition of its benefits, but there's a study that's just been done in JAMA Psychiatry in the November edition of that, kind of mindfulness-based stress reduction versus escitalopram for the treatment of adults with anxiety disorders. And mindfulness was found to be as effective or non-inferior, the study, so it sort of claims, as a 10 to 20 milligram dose of escitalopram antidepressant. That was across 276 patients. And there's lots of other studies that way about the effectiveness of mindfulness as a treatment. But we found particularly that mindfulness brings this ability again to find a way to settle your world and then to begin to see it clearly and then to take some meaning. But again, we found that there's a need to contextualize this. So remembering again our idea of the record, getting stuck on the grooves, that mindful stress reduction is more of that lifting of the needle, those moments where we can just stop that thought in its tracks and reset. But also mindfulness can be a way to change the record, to think differently. And that can be sometimes through that sense of taking meaning from things. So to give you a few examples, I could teach a simple breathing exercise where I ask somebody to recognize the upward and downward movement of their rib cage as they breathe, to feel their diaphragm pulling down, to feel the process of air coming in and out of their lungs, and to focus on that physical aspect. That in itself will calm them as oxygen comes to the brain, as their parasympathetic nervous system is stimulated. It's a calming thing. And maybe I might match that to the movement of trees in the wind or of clouds moving across the sky. That in itself is a mindful, stress-reducing activity and might lift the needle. But I might also be able to say, as you're breathing in, focus on what you need. Just as your lungs are filling with oxygen, which is what your body needs at that time, what is it that you need? And to imagine breathing that in. Or on the outward breath, maybe just think about letting go of those things you don't need that you want to let go of. It's a way that can take meaning from that experience, and it might begin to change the record. Some of the studies done around gratefulness and the way if we appreciate life and the positivity of life, that it can change our way of thinking. Maybe as I'm breathing in, I'm thinking, what am I receiving today that I'm grateful for? What is it that I want to let go? Now, we found again, working contextually, that for some people, spending time in their thoughts isn't always that helpful. So we might use a physical metaphor, hence the snow globe, or maybe the stress ball. But it also might be something like this Monstera plant, which I started growing a few years ago just from a little shoot and is now rapidly taking over our office. And focusing on a plant like that, looking at its detail, looking at the detail of each leaf and the incredible kind of detail and beauty of it. But it also might lead us to think about things like flourishing. How can I grow in myself? What are my conditions for growth? To use that as an example of a natural thing that we can mindfully reflect on, we can take notice of, but that also can enable us to think about how we change the record. What waters me? What are my conditions for growth? Who cares for me? Those kind of questions can begin to come out. We've also find that language is important. And what I mean by that is not so much our spoken language, but the way we process information, the way we think about ourselves. One of the conversations I begin to have when I talk about men's mental health is not so much that it might well be a gender thing, and it could well be, but more what comes out is how we process information. So, for example, if you're more of a physical person, then how do you express mindfully your physicality? How do you talk about your emotions physically, as opposed to doing it verbally, which most of our settings within mental health care seem to be? It seems that mindfulness and some self-care techniques really help us with this. I've spent a little bit of time doing some mindful baking with people. Okay, how does that work? Well, mindfully preparing bread. So as dough is being kneaded, you're thinking about how it feels. You're very present in that experience. And that in and of itself can be a really healthy and good thing. But as you're doing this, you again might begin to see things that speak to you. You might take meaning. Let's imagine you're making smaller bread rolls from the dough that you're creating. And as you create the dough, you might then break it down into smaller pieces. And you might recognize this is a wonderful way to view life. Rather looking at big problems, I might break them down into smaller ones. That kind of physicality can really help. When somebody finds it hard to express themselves verbally, but maybe can connect with the idea of doing something physical, creating or making, or whether that's a sport, or whether you see the world in a different way, visually or through words. Maybe a creative tool like a doodling or creating a collage might be a way that you mindfully reflect on your life. We also find that some people don't necessarily want to always be talking specifically about their emotions, but might want to ask questions. And so we find questions can be a really helpful way to start reflecting mindfully on where we are. Just going to share some questions that we use quite regularly or that other people suggest that we use. Can I break a problem down? That idea from the bread dough. You know, which piece needs to be considered first, which pieces can wait, but also things like what's in my control, what's helpful and harmful, can be a way to mindfully reflect on where we are, what we feel. Something that enables us to see things, to be present with our emotions, to be present with our concerns and fears, and then to ask gentle questions of them. So that's a lot of our bread and butter work. And particularly with the waiting list project that I mentioned, we've been working now for just under a year with Single Point of Access in Sheffield and worked with around 30 individuals, helping them through a process, usually 6 weeks, looking at different subjects, but contextualizing the Wellbeing Zones course that I mentioned into something that adapts to their lives and to the questions and challenges they're facing. And sometimes we will go session to session to session, but sometimes there might be particularly ways to adapt it. If you're suffering from agoraphobia as part of what you're working through, how does self-care and mindfulness connect with that? How can I mindfully reflect as I begin to overcome some of those challenges? Working contextually. So what's your language is always our first session. Using some visual stimulus, some words and some ideas. Asking people if their mood was weather or a color, what would it be? Enables you to get into their way of thinking and then applying some of the tools that we've got, depending on how people work and think. There's a number of bits of learning, I guess, that we've drawn out from that I just want to share with you. And hopefully then this leads into some questions and discussion. And again, this is offered humbly, but things that we've found make a lot of sense with this type of work, and hopefully might resonate with some of the things that you're doing. Hopefully you can see that okay. So firstly, that element of the well-being access, the well-being continuum and mental health first aid has been really important. That we try our hardest and our boundaries sit on working on that upward access of well-being. Whilst we're aware that many people we're working with are on the horizontal axis of poor or healthy mental health, we're trying to focus on the well-being aspect of their care. And that's where we have found mental health first aid really helps. We'll train all our volunteers in mental health first aid as well. And so there's a consistency about the way we work. Now, mental health first aid has some criticism, and quite a lot of that I can hear and accept. But I think a lot of it is about working around boundaries. And what are the boundaries of that work? Making sure that we're not doing pseudotherapy in any way, but actually there's something quite specific that's being worked on. And that's this element of self-care and mindfulness to move towards an element of adaptive resilience where we can move with the different things that happen. So it does mean it fits really well alongside other care, that it works alongside mental health services or works alongside psychotherapy or counseling services that people might be receiving. Working out how that works in tandem is always a good conversation. And we try and make sure that when we receive a referral, that it's really clear what it is that we're doing and what other people are doing. But building those skills up can help people in a forensic setting to deal with transitions, can help people needing to work on emotional regulation within the work with single point of access, but can also help creative artists at a festival, or help people in a local company, or help key workers as they're caring for others, or help teachers manage stress as they're going about their daily work. We're looking to build a toolkit for the whole of people's lives. So recognizing that everybody is different, that people speak different languages, whether it's physical touch, whether it's their imagination, whether it be words, questions, different approaches. So we're coming in saying not everything we share with you might work. That's okay. It's about finding the things that do work for you, but also noticing that individuals will then adapt ideas. I work with somebody around visualizing a place where they feel calm. And they talked about being in the bath and how the bath is a place where they feel calm, and thought about all the things they feel about that, and tried to imagine visualizing those feelings and sensations and how they felt there when they were in a stressful place. And they found that that didn't work, but what did work was visualizing a beautiful seaside that they used to go to on holiday when they were young and feeling like they were there on the beach, and that did work. So coming back the next week and finding, oh no, well, the idea was great, but the particular example you suggested didn't work, but I tried this and then it did. Which leads me on to empowerment, which is really important. And I'll come on to that a little bit more, but these are good tools and techniques for self-expression. People begin to learn not just what helps them, but rather than an expert and a patient, it's more we're working together with an individual to help them discover things that work for them, what's in their own toolkit. Finding a person's language leads on to context, that working contextually really helps. And this is a massive challenge when we're working with maybe in a bigger organization with so many people, but the ability to adapt seems to be really important to help some people, to be able to listen to their specific needs. Maybe somebody only wants to work on a phone initially. Okay, we can work with that. Maybe somebody needs a home visit rather than to come into a center. Okay, we could work with that. Maybe somebody struggles to concentrate a long time to do a breathing exercise. Can we do something shorter, like the stop process? Adapting people's approaches, but then adapting also cultural stories that we might use, language, translating things, finding different metaphors that work for people, understanding what makes people tick. I mentioned the idea of transitions, and using and learning these tools for those transmission movements seems to help people transition through different elements of care. If you imagine the stress of being discharged, for example, learning some grounding tools and techniques seem to help when those moments of crisis come. How can I begin to manage these times? And yes, that moment of crisis still may come and they may still need help. But that sense of management has meant, at least with the people we've worked with, a few less have fallen into crisis and had to go back into residential care. So transitions has been a really important piece of learning. These things work well, and we'd like to explore other transitions in life and other stressful transitional times and see how this helps. Focusing on resilience building has really helped, and learning what we think that means. So that NHS definition not necessarily being about a thick skin or being defended or being strong, but also it might be about finding ways that I can adapt. We found the image of an oak tree really helps. The idea of finding a way of resilience building where we move with the wind, our roots being as important as the thickness of our trunk or what grows on top. Or even beginning to talk about this idea of flourishing, that we might not work not just with a crisis or a challenge, but we might work with self-care and mindfulness to help people really understand, well, who do I want to be? What's my sense of purpose? What would I like to do with this next stage of my life? We found a number of the people we work with want to then go and volunteer to give something back, or might find actually there's something they've been longing to do for a long time and haven't done it. And these kind of sessions draw that out. And that in itself, growing somebody's well-being as they try something different and find that actually a new sense of flourishing in them as a person. Two other thoughts, and then I'll kind of come into land and we can do some questions. This work is best done as proactive and preventative, but can be used in a restorative way. I guess this is one of our challenges, because most of the people that we have referred to us within the mental health system need restoring in some way. And actually the place we'd really like to work is probably in primary care, or even before that, where you're working proactively and preventatively. I'd love to know what people's thoughts are on that, but also if there's any energy in the association or amongst people that are here today to think about more preventative use of self-care and mindfulness and how we do that. And lastly, empowerment, that this is about enabling people to make choices for themselves. We start by saying that you're in control. You don't have to do these sessions if you don't want to, but also that we're willing to adapt as much as possible to the needs that you have so that you feel empowered as a person. And then to go from there about equipping what's your toolkit. What are the things that you want to take forward from this? What are the things that help you? Trusting a person's view of themselves, being very client-centered. People knowing what they want to do. So that learning is kind of ongoing. And again, I'm really looking forward to some questions and to talking about it. We're only 6 years old, so Space to Breathe is relatively young and we're very small. We're trying to grow and develop and learn. And I guess coming back to my first point that I made, I don't know whether we entirely anticipated that we would be in this space or that the work that we were doing would be as effective as it is. In our waiting list work, we found that the recall scores for people that we're working with are as effective and sometimes more effective than other forms of service. It depends on the context again. But we found that this is something that's fitted in well. That then provides challenges about how do we work with the NHS and how does the NHS work with the voluntary sector. But it feels like there's a place for this kind of work alongside other care, and it's something we really like to explore and develop. I think that learning is kind of ongoing. But maybe if we do find ways that we can help people ground themselves to see their world clearly, to then look at techniques to build a toolkit with a view to being able to address and isolate the different challenges and anxieties and stresses that they face and have that adaptive approach to resilience, that I can move with the ups and downs of life, then maybe we can have more people like my mom Stara here who really flourish in the environment that they're in.